Okay, guys, I think we'll start. Everyone's kind of still coming in, but I think we'll start making a start. So thank you so much for joining. Good evening. I'm joined today by 3 panelists for this talk entitled Change is Natural, Understanding Your Birth Control Options. So I'm Alice, I'm a freelance journalist and I mostly focus on sexual and menstrual and maternal health. And joining us today, we'll start with our experts. We'll start with Elina, if you would like to introduce yourself.
Yes, of course. Hi, everyone. I'm Elina and I'm a co-founder and co-CEO of Natural Cycles. And well, long story short, I founded Natural Cycles out of a personal need of a non-hormonal, non-invasive, but effective birth control method. I had been using the hormonal implant for 10 years and I knew it was time to switch it, but I wanted to have kids in a few years. And I thought it's good to leave my body some break from the hormones before getting pregnant. And I'm originally a particle physicist, so I was working on the Higgs discovery at the CERN laboratory in Switzerland at the moment. And I thought that I can use my skills in particle physics that is a lot about analyzing data to make an algorithm that analyzes women's body temperature to pinpoint when you ovulate and when you're fertile and when you're definitely not fertile, to figure out how to use that as a natural birth control that's effective. And that's how it started.
It's amazing. It's exciting. We're also joined by Jennifer.
Hi, everybody. Thank you for having me. This is a great event. I'm Jennifer Peña. I'm an internal medicine physician, currently serving as the Chief Medical Officer at Nurx. At Nurx, we're a telehealth platform. We focus on birth control, emergency contraception, PrEP, STI testing and treatment. We also do migraine treatment and skincare conditions. We like to say, we focus on sensitive healthcare needs and bringing down those barriers to access to care through telehealth. So really just making sure that we make care for everybody easy and accessible. It's a great opportunity to talk about birth control, especially nowadays that, the control of women, to have control over the reproductive care is so important and it's so present on the news. And in honor of Contraception Day, I'm just honored to be a part of this panel. Thank you so much.
Amazing, thank you. And then last, we also have Dr. Fahimeh.
Hi, I'm Dr. Famas Hassan. I'm Kindbody's founding physician and our Chief Medical Officer of Obstetrics and Gynecology. Kindbody runs a national network of reproductive health and fertility clinics across the country, from coast to coast. And one of our core missions is to truly empower and educate men and women about their reproductive health and fertility options and family building options. And just so excited to be here on World Contraception Day as we really evaluate the need for not only having good women's health care, but also recognizing that fertility and reproductive health is something that most of us, unfortunately, within our population know very little about. And one of my missions as a founder and why I'm so excited to be here with this panel today is to increase that education and to take away some of the stigma that exists when it comes to menstrual cycles and contraception and fertility. So really, really thrilled to be having this dialogue with all of you today.
Absolutely. Just kind of as other people join the room before we get started, just make sure you check out the poll and we'll read out the results at the end. And also, as I said, if you have any questions, pop it in the chat and we'll get to those at the end as well. So to kind of kickstart the conversation, as we kind of looking at access and change in your contraception and things like that, resources, just opening to kind of all the experts, do you think birth control for some people is still a taboo topic, and how do you think that barriers could potentially be broken down more?
Yeah, as an OBGYN, I mean, I take care of patients of all ages, from young girls who come to see me for their first menstrual period to, women who are in their 50s. And I think the reason it's taboo is there's a lot of lack of information and misinformation. And I think it's so imperative that we as a society talk more about contraception so that, the teenagers who are afraid to tell their mom they need to start birth control because they're worried about how she'll feel about being sexually active, or who have horrible menstrual pains, who need birth control to help with those pains, or to address, maybe they're not even sexually active but need to have contraception for other reasons. So there's so many avenues of why it's important. And then on the flip side, my 50-something-year-old patient who still menstruates, who thinks she needs birth control, even though the likelihood of her conceiving would literally be, zero. And so I do think it's taboo. And the most important reason is there's a lot of social barriers around it, and there's a lot of stigma, especially cultural stigma. And then, of course, the lack of education, where you have, like I said, women in their 50s who think they can still get pregnant naturally, and then everywhere in between. So absolutely, I think there's a lot of taboo. I think just in general, we don't talk enough about women's health.
Yeah, I agree with Dr. Sasan. One of the things I would add is that we have a really unique opportunity through telehealth to educate. It's amazing in this country, we're one of the most literate countries in the world, right? But there's still a high degree of health illiteracy. And yeah, to Dr. Sasan's point, it just starts at a young age, and not having those sex education programs as readily available as it should be. And so I know, for example, in our telehealth platform, in addition to providing telehealth services, we also really make sure that we educate not just our own patients, but the public at large. And so, yeah, it's just there has to be more of an initiative from different organizations and different companies to really supplement that lack of information that's coming from schools, education systems, and making sure that we set the record straight on a lot of the misinformation that's out there, unfortunately, on the internet and social media.
Yeah, I definitely agree with that. And we also see among our users that on average are 30 years old. And since natural cycles is a way for them to also get to know their body and figure out what's going on inside, they tell us every day how empowering they feel that is, because they had no idea. They don't have the basic level of education before of what is ovulation, how does it affect your body, what's PMS. And many have also been on hormonal contraception for a decade or more, and was put on at a very young age to maybe mask a symptom that they had then. And it's very different now when they're 30 and maybe want to get pregnant soon. So indeed, like, empowering women with knowledge is part of our mission. And we see that natural cycles can really do that by also the personalized algorithm showing them what their unique cycle is about and their unique body.
And sort of touching on that, Elina, natural cycles is kind of a relatively new form of birth control compared to other things that are out there. So I assume many people will come to it having sort of made the decision to make a change. What do you hear people say? Like, what are kind of some of the things that people have said to you?
So the vast majority of our users come from previously using hormonal contraception, but they have had side effects, or they've become aware of the potential side effects. And indeed, since the average user is 30 years old, many of them are also thinking about pregnancy in the near future and wondering how does it actually work. So indeed, like, we see that many users have also switched birth control methods several times before starting natural cycles. So when we asked our users, we heard that 86% of them have switched their primary method of contraception 2 times or more, which is quite a lot. Yeah.
And Dr. Sasan, you touched on it before. You have a range of patients from young teens to 50-year-olds. What are some of the reasons why people might consider changing birth control, and what are some of the things that you discuss with them when they come to making that decision?
Yeah, first and foremost, I mean, obviously, and Elina touched upon this. You meet women who were put on birth control when they were sometimes teenagers, and they've just kind of just kept refilling the prescription. And so I always like to just have a really thorough conversation on all the aspects. Like, why do you need birth control? Because it's not always for birth control purposes, right? So what is your reasoning for taking this medication or using this tool or using this device? Number one. So what's our goal? And then what are your menstrual cycles like? What's your menstrual history like? You know, it's really important to take that into consideration, because a person who has very heavy menstrual periods and bleeds for 7 days every month is very different than a person who bleeds for 2 or 3 days and barely needs to use a panty liner. And so, because that's going to impact their health differently. And then addressing lifestyle, you know, some people work at night, and having a pill that you're supposed to take every morning, or doing something that requires a lot of personal intervention, whether that's taking a pill or putting in a ring or taking it out or getting a shot every 3 months. They either have phobias or they just don't have a personal diligence to be compliant. And so I think all of those things are so important. And then addressing long-term goals. You know, when do you want to be pregnant? I certainly don't want to put in an IUD in someone who's planning a pregnancy in 3 months, because what's the point? By the time you adjust, we need to take it out. So I think it's really important, and I really encourage everyone who's joining us today to have a conversation with your provider about your contraception, and make sure that if you've been on something for a long time, that it's still the best choice for you. And to always make sure you're bringing up, you know, not just refilling the prescription out of just habit, but that you're bringing up things that maybe have changed for you, whether it's your mental health, your emotional health, your physical health, other medications. So I just think there's so many factors to play a role. And I really want to be much more thoughtful as experts in women's health about contraception, and that one size does not fit all. And that just because something worked really well for you at some point in your life, it might be time for a change.
And Dr. Peña, are there sort of other contraceptive recommendations you would maybe make to someone who is in their teens or their 20s, to maybe someone who's in their late 20s, early 30s, 40s?
It's an excellent question, and we get that all the time, because we see a range of ages coming through our you know, telehealth platform doors. And normally we don't, right? We just want to make sure, to Dr. Sasan's point, that we're educating our patients to the best form out there for them. You know, what are they looking for in terms of their contraceptive methods? What are their plans? Are there plans for pregnancy? Side effect profiles too, right? You know, especially with the younger population, you know, if it's something, say, for example, that's going to cause maybe a little bit more breakthrough bleeding, and that's something that will impact their school sports or something like that, you know, that's something that's important. But again, it comes down to just being very thorough about educating our patients, but also having that two-way conversation, having our patients really be forthcoming with us as to what it is that they're looking for, how much do they know is out there, make sure that they understand the full range of methods, and making sure that you know, it's also the right thing for them depending on their profile, right? If they have any contraindications to certain methods, if they have any other medications that interact with certain, you know, certain oral contraceptive methods, et cetera. So yeah, it just, communication is the key, and education, but no real differences, honestly, most of the time.
And Elina, you touched on your personal experience before, but for people who are considering maybe getting pregnant in the next few months, next few years, are there kind of different birth controls to look out for, maybe over others?
Yeah, so we published a clinical study showing that if you use natural cycles to plan a pregnancy, coming from natural cycles birth control product, is then you get pregnant faster than if you come directly from using hormonal contraception. So on average, you get pregnant 60% faster. a lot because you already know your own body. You've gone back to ovulating again and having a natural cycle. However, what we see is that there's no impact on fertility after 1 year after you quit hormonal contraception. So if you are looking to getting pregnant, maybe it's a good idea to think about it like a year in advance and, you know, quit hormonal contraception ahead of time and get back to ovulating again. That could be something.
I do just want to piggyback on that, though, to just, since we're being conscientious, though, but to realize that if someone isn't ready for pregnancy a year prior, that recognizing once you're off birth control, you can get pregnant. And some people get pregnant immediately after they stop contraception. Obviously, we all know people who even get pregnant because they didn't take their birth control correctly. So I just want to be responsible in that. While for some women, it may take them a little while to start ovulating again and pregnancy may delay, some people do get pregnant immediately upon stopping contraception. So just making sure the timing is correct for you and or your partner, because it doesn't always take a long time after stopping contraception to conceive.
Definitely. And then natural cycles is actually a very good product in the meantime to use as a birth control method. Since natural cycles also has a typical use effectiveness that is 93%, which is similar to the contraceptive pill, they would actually switch to something that is similarly effective, but then they can get pregnant as fast as possible when they're ready.
And on kind of that note, for people who have been pregnant, who have just had a baby and are kind of looking to get back onto contraception, are there any that kind of you would recommend or that you would kind of talk through with a patient, Dr. Sasan? Like, is there stuff to look out for, or would you say kind of it's very much patient specific?
Well, first and foremost, after having a baby, the key factor is whether or not the patient is lactating or breastfeeding, because that obviously changes the recommendations. So in women who are breastfeeding, and also there's a difference of breastfeeding exclusively versus doing bottle and breastfeeding, but certainly we do have some restrictions. So if you are breastfeeding, we don't do any estrogen containing forms of contraception because that's been shown to reduce breast milk supply. I think it's also important to, again, review all of the different aspects and lifestyle characteristics that the patient has. And also to be honest about the level of sexual activity. I find that a lot of women immediately in the postpartum period are not really sexually active. And if you're exclusively breastfeeding, then that exclusive breastfeeding itself can be considered a good form of contraception, especially if you're not planning on being sexually active immediately. So I think it goes back to the entire topic for today, is it needs to be really individualized on the person, and then really highly taking into consideration their whether or not they're breastfeeding, and then from there it goes back to side effects and what you've used previously that you liked and what you're comfortable with, and you know, your return to work if you're planning on going back to work, and juggling all of the new amazing things that women juggle after having a baby, including maybe having some menstrual irregularity, you know, which makes you're not sure quite when you're going to go back to getting your periods again, or sometimes there can be some irregularity, especially if you're doing partial breastfeeding, bottle feeding. So I think there's a lot of factors to play a role, and it's definitely warrants a nice thorough conversation with a provider and exploring all of that.
For sure. And Dr. Peña, have you noticed any trends or kind of certain methods becoming more popular, or certain methods being asked about a little bit more? Because I think the contraceptive pill has been a very popular option for quite a long time. Have you noticed any rise in popularity of any other methods?
Yes, we definitely get asked about, you know, obviously the pill. We get asked about different types of pills, so estrogen, progestin. We get asked about barrier methods. We get asked about the longer, you know, IUDs and as well as the shot. You know, we in our platform are able to offer a fair amount of options, which is great, as it gives us the opportunity to educate our patients as to the different options. We are limited, of course, to telehealth in terms of things that require a procedure. So any procedural methods we can't provide, but we still are able to have our providers engaged in that education and conversation with our patients. I think, nowadays, because of the cost share, removal with a lot of even the IUDs and the implantable methods, we are seeing more, of an interest in learning more about those because now they're affordable to people, whereas before, the patient still had to cover the cost of the device as well as the procedure itself. The visits were also very prohibitive for people who lived far away from an OB-GYN office and didn't have that access to those clinics. If they live in, as we say, contraceptive deserts, places where they might not even have the availability to get these, options available to them. That again, with the cost share reduction, has been a significant, improvement in removing that barrier to access to care. So we still get, a lot of patients asking about the pill, but I think that there's definitely a lot more interest now that it's affordable to get some of the other methods.
Mm. And you're obviously a telehealth platform, and over the last 18 months, life has changed entirely. Do you think the pandemic has impacted access to contraception and also resources for contraception? And how have you noticed that?
Oh, 100%. So obviously during the early days of the pandemic, when everything was shut down, we saw a tremendous increase in our demand for birth control, again, because everything was closed. People were afraid to leave their home. There was no appointments available. But what's interesting that we're seeing now is that people are coming back for those refills. So it didn't end, because we're still in the pandemic, but it didn't end this year. People are coming back and wanting to remain in those birth control methods. And, a lot of people lost their jobs. They lost health insurance. So one of the things that's important too is, continuing to make this accessible and affordable, even for people who don't have insurance. And also, again, just making it easy from a convenience standpoint, right? Because, women tend to be the ones that we call the CMOs of the household, right? We tend to be the ones who have to stay home, take care of the children, take care of our loved ones, our elderly who maybe are sick, et cetera. And so, again, we're seeing a continued interest and demand for birth control. Again, whether it's financial constraints, also the uncertainty, right? For these women who have lost their jobs, it causes a lot of anxiety. And a lot of people have put their pregnancy plans on hold because of that, because there's just this uncertainty of what the future holds for them. And so we'll see what the next year shows, but there's still definitely an increased demand and need for these methods.
Yeah, we saw quite a big rise in interest in the beginning of the pandemic, as natural cycles is a very affordable option over the counter, or actually online, so you don't have to go anywhere to get it. So we saw a big jump in our numbers, and we're happy to help so many women during pandemic get an affordable birth control method. And also, since our users measure their temperature every morning, usually they tend to skip on the weekends because of lifestyle and partying. And since that went down during the pandemic, we actually saw much more temperature data coming in the weekends, which was exciting to see as well.
And then Dr. Sasan, I was going to ask you a kind of similar question of how have you kind of noticed changes in sort of sexual health care over the last 18 months, year?
We at Kindbody have really advocated for from day one. We also have a very strong virtual platform prior to the pandemic where our patients can do virtual consultations, both for gynecology and fertility, virtually with us from around the world. We do consultations for both men and women as it relates to their reproductive health. And so that's something we always championed. And we certainly did see an increase of patients just seeking in general virtual care, as I'm sure has been the trend across the board. But one of the things that we were really passionate about was that reproductive health and certainly our contraception and every other aspect of women's health, it was essential. It was always essential, and really wanting to make sure that everyone had access to it, because just the pandemic and because the streets are closed doesn't mean that your medical care comes to an end. And so I really want to advocate, and I know there's still a lot of women out there who haven't gone to the gynecologist or had their annual checkup, and now over a year just waiting for the pandemic to end. And as we all know from the world, it's not necessarily coming to an end. Certainly the vaccine has improved it, but I just want to take a moment and really stress the importance for everyone that's here to please, if you haven't seen your physician in over a year, to do that. The importance for breast exams, pelvic exams, to talk about contraception, talk about your fertility and your reproductive health. Is just such an important part as we talk about cancer screening and general health. And I know a lot of women in reproductive age, their gynecologist is their primary care physician. And so I just really want to advocate for making sure that we're taking care of ourselves, now more than ever. So that, and whether you do that virtually or you do that in person, the importance is to get the care. And so I really want to advocate for that.
I'll piggyback and say, in the interest of public health, whether it's hormonal or non-hormonal contraception options that you pick, sexually transmitted illness is an issue. Please make sure that if you're, going back out there, becoming sexually active again, if you took a break during the pandemic or if you didn't, either way, making sure that you're getting tested, that your partners are getting tested, that you get treated, because, again, to Dr. Hassan's point, some of these infections cause cancer risk, right, with HPV. And there's ways to prevent things like HIV with PrEP, et cetera. So make sure that you're also taking care to be preventive with things like sexually transmitted illness.
And there's been kind of more conversations over the last year about safety as the vaccines came out. There was a lot of talk about blood clots, and then that brought into sharp focus the risk of blood clots with the pill. Elina, I was going to ask you do you ever get asked about kind of how Natural Cycles works, the safety of it, and like what kind of is your response with that?
Well, safety, it's since we have no side effects, it's safe in that sense, but an important part of contraception is also different effectiveness methods. And there we see also there's a big gap in education, and many people think that, for instance, the condom or the pill are the most effective methods, but it's actually long-acting methods like the IUD or the implant that are more effective, that are inside your body. You can forget about it. Natural Cycles is 93% effective with typical use and 98% effective with perfect use, meaning that perfect use means that you actually use protection when the app tells you that you're fertile and you get a red day. That's the only difference between the two. It's not how you measure your temperature or anything like this. That's also a myth that many people think. And 93% effective is more effective than, say, using the condom alone, but it's indeed less effective than long-acting methods like the IUD or the implant.
For sure. And Dr. Sasan, kind of for people who are slightly concerned about side effects with, say, the pill or other forms of long-acting contraception, kind of what would you say to them to kind of put their mind at ease, maybe?
So incredibly important, again, whether you're doing it through a virtual platform or with a provider, is to make sure that you have a thorough review of your medical history, surgical history, medications, other medications you're on are so important, and prior experiences you've had, and also family history. So, if someone has a significant personal or family history of blood clots, it's really important to not ignore that and to mention that. And in those cases, I will always recommend to having a proper hematology evaluation, because then you can actually be diagnosed with a blood clotting disorder, which is important for you to know in any aspect, whether you're planning a pregnancy or not. Obviously impacts your contraception, but it's also important for your general health, as there's obviously factors that need to be taken into consideration and treatment that needs to be initiated. But I also want to highlight, though, that in the general population, the risk for blood clots with hormonal contraception is actually quite small, and that shouldn't be a reason to avoid it. Now, again, that's where a very thorough medical history becomes so important, because that will highlight if there is an issue. But I don't want people to steer away from contraception because of that fear, because that I think is misinformation out there. And there's also been a lot of improvements made in contraception to reduce those risks. But if someone does have other comorbidities, we obviously take that into consideration. So someone with a history of a blood clot, or who has high blood pressure, or who has diabetes, I'm more prone to use non-hormonal contraception for, which can be natural cycles. It could also be a copper or Paragard IUD. In those cases, sometimes a progesterone-only contraception can be also a good form. So the thing that I want to just highlight is that just because you do have another medical issue or you do have a history of a blood clot doesn't mean you can't use contraception. There's so many different options, and then it's just exploring which one is best for you. And to not be scared about having this conversation, because usually if you just highlight what your concern is and then go through a thorough medical history, you can always find something that's going to work for every individual.
Sure. And Dr. Peña, kind of as far as accessibility goes, what are some of the things that potentially do you feel are barriers for people to explore other options?
Yeah, so along the lines of what we were talking about before, some of the biggest barriers that we see are, people who just don't have that access, in terms of clinics. They live in these contraceptive deserts in the United States. I think there's an estimate of 19 million women in this country that still live in these areas. And a lot of those are southern states that we like to focus on because we know that there's that need there. And that includes all methods, really. There's also some folks that live in what we call pharmacy deserts, where even if they have accessibility to pharmacy, the pharmacy might not necessarily carry the full formulary of options that we've been talking about today. And a lot of those tend to be in more rural areas as well, where there's just no kind of reciprocity of pharmacies, where the person, if they don't have it in one pharmacy, can move up to another pharmacy. Sometimes it has to do with shame and stigma. We were talking about a little bit before. They might live in a small town where the doctor or the pharmacist is like their family member or somebody that they know, right? And they might have this shame or stigma to have to go and get, some sort of a contraception method from somebody that they know. And again, at the end of the day, like we were talking about as well, is convenience. Which, as women, we just face a lot of barriers to be able to get that access. I agree with Dr. Sasan. It's important for us to remember we have to go take care of ourselves. If we don't take care of ourselves, we can't take care of our family members and our children. And again, with women this past year, especially during the pandemic, just being very limited as to how much a lot of us could do and leave the home. We've lacked a lot of that essential health care. And so you factor in transportation, taking time off, having to get a babysitter, et cetera, and just availability of appointments. All of those are barriers to pretty much all the methods. And so I'd say whatever we can do to try to minimize those barriers and improve that access is just a tremendous service to women in this country.
For sure. And we've touched on already kind of information and education surrounding birth control as being sort of a key factor in helping people make choices. Elina, Naturals does kind of act as a educational platform as well, and it does kind of provide a lot of resources. What are kind of the key thinkings behind that, and kind of what messages would you want to put out there on the app?
Yeah, so that's definitely something that we've learned over the soon almost 10 years that we've been around, is that when it's important to educate women and also men around contraception, but also reproductive health and health in general. So we really try to be a thought leader in this field, and we educate not only about natural cycles, but also about different contraceptive options and about menopause and all these topics that are so important to know about. We actually have our users often ask, like, why are you talking about the other contraceptive options? You're supposed to promote natural cycles. But as we've touched upon today, there's no one size fits all, and also different methods work for different women throughout their reproductive lifetime. And it's important that women know what options there are out there and can compare their pros and cons and what fits them in that moment. So we try to educate in general around women's health.
And Dr. Sasan, kind of what role do you think that school sex education plays in teaching young people about birth control and kind of demystifying some of the stigmas that may attach to it?
Well, the current status, and I can say this unequivocally, I'm sure across the world, as many of our listeners are from Europe, is horrendous. It's horrible. The current status of sex education and reproductive education in the world teaches boys and girls that the moment they, have sex, they're going to get pregnant, and creates these huge misconceptions that bring a lot of fear about sex and about reproduction, and I think if we've learned anything in medicine is that fear is not the right answer to education, and I think that as a result, unfortunately, people just go to other platforms and they go to Dr. Google and get lots of misinformation and misguidance, and then that misinformation stays with you for your life because no one else ever teaches you differently. I mean, I know full-blown physicians who have gone to medical school and residency who have very little knowledge about reproductive health and contraception and fertility, and so that's also, a big part of what we do at Kindbody is fertility awareness and the understanding that for women, time is fertility's worst enemy. And, I meet 40-year-olds who cry to me that I can't believe I'm not fertile anymore. And I thought I would get pregnant easily and I take care of myself. And so I think the most important thing we can do is to really revamp our health education, sex education in our schools to be honest and not based on fear, but on actual dissemination of information, and that young people are smart enough to be able to handle it, and also do good education on menstrual cycles and that it's not shameful, and what is normal bleeding, so that a young girl who has heavy periods doesn't think this is normal. So there's wow, we could spend a whole lecture just talking about. I think there's a lot of disparities too, and also to highlight that sex education doesn't exist everywhere. There's huge portions of the country and the world where even what I think is a bad talk isn't even done, and that boys and girls go through their whole life never really being told anything. So I'm hopeful that platforms like Natural Cycle and Nurx and Kindbody can really start having more and more of these conversations, because they're certainly needed.
And I saw that, Peña, you're kind of very much nodding your head there. Kind of, what's your thoughts on it? Kind of, where do you think maybe you would want conversations to go or progress?
Yeah, I think it's timely, that question for me, because this is in the United States, the start of Hispanic Heritage Month, right? And I think a huge part of this is also a cultural component. There's this cultural barriers that come into play when we're talking about sexual reproductive health and stigma, and and even basic understanding. I'll tell you from personal experience in Latino culture, there's all these old wives' tales, right, about the things that help with contraception, things that don't help, things that help with fertility, things that don't help. And you grow up thinking about these things. And I still have a mother and grandmother that live with me that tell me these things, right? And so, it's also having that cultural competency and understanding, especially us as providers and platforms to deliver care, to make sure that we're educating, but also sensitive about those cultural differences that, that unfortunately act as barriers to good access to good reproductive health. So that's one of the things that I personally take very much to heart, and try to increase that cultural awareness as well surrounding this topic.
And kind of just lastly, before we come to our last of these questions, if you guys have any questions at all, if you just pop them in the chat, we'll be coming to those shortly. But kind of the last question is just looking forward. I'll open this to you, but we'll start with Elina. Like, what big things do you see coming in for birth control? What progressions do you see, especially with natural cycles?
So we're very excited that we got FDA clearance in the summer to use natural cycles, not with a digital thermometer in the morning like our users use today, but with a wearable that measures temperature and heart rate during the night. So we're very excited about that because we see that some of our users, they forget in the morning, especially like if you have young children, you know, it can be difficult. And also because, you know, as a scientist myself, like the more data, it opens up to more research and more improvements in the future. So that's what we're working hard on, and we're currently assessing which wearables to provide and use for this integration, because it's important to also do it right and do the proper validations and the clinical studies needed to launch this to our users.
And Dr. Sasan, so same question, sort of within either the realms of kind of medical progress or education, kind of what changes do you see?
Yeah, I think there's definitely more, and this conversation is starting to be had more. And I think it's behooves all of us, and that's why I'm so excited to be here with my co-panelists, and that I think our organizations are shouting it from the rooftops, and I hope that more and more women start to share their stories. And I think it's through these conversations that we destigmatize the topic. And I think that education and empowerment are so vitally important for both men and women about reproductive health, about contraception, about fertility, about family planning, about that you don't have to have a man and a woman to have a baby. And, you know, that's like yesterday. And there are so many barriers. And it is National Hispanic Heritage Month. There's barriers in cultural competencies, socioeconomic competencies. Women of color tend to get this care much less than their Caucasian counterparts. And so one of the things that we are really passionate about at Kindbody is really coming and taking away those barriers where women feel like they have to go and see a fertility specialist to learn about fertility, that this is information you can get through a virtual Zoom meeting with a physician, that there's so many platforms to get the access to proper information. And so I think the most important aspect of improvement for all of us, and certainly new tools and instruments become important, but I think first and foremost, it's expanding the conversation to include women and men of all races and colors and socioeconomic boundaries, and people who live in middle of small town and rural communities to big cities across the world. And so it's something that we at Kindbody are really passionate about. And that also leads to equity for LGBTQ community as well, as that's an area where contraception and fertility are often overlooked.
And Dr. Peña, same sort of question.
Everything that was said, and I'll double down on the LGBT community because, it is overlooked, unfortunately, a lot in traditional practice, even in a lot of telehealth platforms, so just having that awareness. But yes, education and hopefully more options, right? Continuing to research, to Elina's point, and do more science, more data, more options for people, and at reduced costs for those people with not insurance, and make this as affordable as possible across the gamut of options, not just a pill, but across the spectrum, so that every woman really does deserve the right and have the right to control that reproductive right. And then also that those new forms, if any new forms of birth control come out, that they should aim to decrease those disparities in access, right? And then I would say the last one would be also more public health initiatives. I think it was just France recently that is offering free birth control now, right, to women under 25. I thought that was brilliant, very innovative, very progressive. And I think that whether it's offering natural cycles, or offering other methods to women at low or even no cost, I think that that's a fantastic initiative, and other countries should follow suit.
Yeah, for sure. So that was great. Thank you so much, guys. I'm just going to go through now some of the questions that people have written in, and I've noticed quite a few about natural cycles about the app, so I'll go to you first, Elina. Somebody has written in, does natural cycles have plans to incorporate cervical fluid descriptions and monitoring and cervix positions into the algorithm, similar to a charting method?
So you can log cervical mucus in the app and take that into account for yourself. However, we've chosen to not incorporate it in the algorithm and give a green safe day based on this, because we know that you need to, it can be very tricky to analyze cervical mucus, and it depends a lot on the woman. It's a subjective tracking method. So if you've taken a 3 months course and you've gotten to know your body and it works for you, that's great. But we want to reduce the human error and only give green days that are definitely safe. So we do not plan to incorporate cervical mucus in the algorithm because of that.
And kind of another one on similar lines, but would you ever consider adding sort of a smartwatch kind of feature for data input?
Yes, so this is what I mentioned before, that we got the FDA clearance to use natural cycles in conjunction with a wearable that measures temperature on top of our existing FDA clearance as a medical device for contraception. However, we do have to carefully validate each device. So it's not like you can just put on the smartwatch you might already have. We have to make sure that it's accurate enough at measuring temperature and that it works for the purpose of contraception. So that's why science and innovation takes time when it comes to health, but it's also important because we have to get it right.
And Dr. Sasan, what is one thing that you would love people to know, men and women, to know about menstruation that maybe isn't considered to be common knowledge or commonly known?
One is that it's a natural part of female reproductive health, and it's nothing to be ashamed of, and it's something that, again, going back to, I think needs a lot more education on. I also want people to understand it's so important to share your menstrual history with your provider, and not just assume that what you have is normal, or also that is abnormal. Because I have some patients who come to me who are super scared that they're not fertile because their period is super light, and they somehow, and again, this comes with cultural misunderstandings that somehow a heavy period means you're really fertile, but it could actually mean that you have a fibroid or a polyp or something that can be fixed. And then just misconceptions, I think, as women get older, that just because you get a period means you're fertile. So I think there's just a lot of understanding and what not getting a period means. If you're not on contraception and you don't get a period, that's something that needs to be evaluated depending on the length of time that it has been, and that things like polycystic ovarian syndrome is a real thing that can be addressed, and that our menstrual cycles are telling us things about nothing in our body happens in a silo. And so it may be, if you're overweight or you're obese and you have, did I freeze for a moment?
No, you're fine.
No, you're good.
I think I did.
Well, now maybe.
We can hear you.
Sorry, here I am. I apologize. And if you have other conditions or you're on new medications that have affected just to realize that nothing in our body happens in a silo. It's so important to explore it all.
And Dr. Peña, could there be any benefits, sort of personalized birth control options, such as a service that measures your baseline hormone levels and then assesses your genetic risk for certain side effects, or trial and error with birth control methods is the best way to go?
I love that question. I think a personalized medical plan for anything is the gold standard, right? That we would all love to have. But I think that, we all aim to do that as providers, is to make sure that we're looking at the whole picture. We're looking at the whole person when we make a plan for what would work best for the person. Just like Dr. Sasan mentioned, what are your risk factors? Are you a smoker? are you obese? Are there certain methods that we know might not be as effective for you, whether you're trying to prevent pregnancy or you're trying to get pregnant? Even things like emergency contraception, right, which we do offer as well on our platform. In the event that you do get an unwanted pregnancy, there's even considerations there depending on your profile, right? And so, yes, I mean, to answer your question, I think having a comprehensive view of all of the things that are factors in terms of your reproductive health to make a perfectly personalized plan would be ideal. Obviously, that's not always possible. It's very expensive. And in essence, it might not give you more information really than just doing a full comprehensive medical history, knowing yourself, sharing all of your information with your provider. It might not really yield any better results. But I say as much informed as you can, as most informed as you can be, the better for sure.
Mm. And Elina, we've had an attendee write in to say, is natural cycles a viable option for those who are not planning on being pregnant in the next few years? I got pregnant with a copper IUD in after other painful issues with it and hormonal because it's given me extreme mood variation in the past. So I feel like I'm running out of options.
Yes, I think natural cycles might be a very good thing for you to try. If you've already tried so many methods and they don't work for you, definitely try out natural cycles. You just have to be above 18 to use natural cycles because we don't have any clinical data on below 18. And you have to keep in mind that it does not protect against STIs, only various methods protect against STIs. But I think, yeah, I always feel for these women that have tried so many methods and got pregnant on the most effective method and suffered from others. Then yes, definitely try natural cycles and see if that works for you.
And someone else has touched on, I was wondering if outside factors like smoking cannabis may affect temperature measurement or any part of using natural cycles.
We have not seen that smoking affects temperature, but for sure, many things can affect temperature, like for instance, alcohol, your sleep. And that's why it's so important to have a robust algorithm that scrutinizes your temperature data, and why charting temperature by hand and having very simple rules is not very effective. So it's indeed important to have an algorithm that assesses the temperature to see that if the temperature rise looks like ovulation or if the temperature rise looks like something else.
Sure. And Dr. Sasan, someone's written in saying, I'd like to know kind of the whole risk of kind of being on the hormonal birth control pill for over 10 years, if there are any.
Yeah, there, again, after having had a thorough and comprehensive review of a person's medical and surgical history, unless there's any direct contraindications based on the person's medical history or changes in their medical history as they've gotten older, there are no known risks to being on birth control for 10 or even 15 consecutive years or more. The other thing to note is that women who are on combined contraception for 5 years or more, there have been studies to prove that that reduces your risk of lifetime risk of ovarian cancer, which is huge. And so that is a benefit that we know exists in 5 consecutive years or more. I think the most important thing as an OBGYN for women to realize is that if you've been on contraception for 10 or more years, that your fertility in that time, and you've gotten older and that your fertility has declined, and just to be cognizant of your lifetime goals. Sometimes people are so focused on the present, they don't think about, I'd ideally like to have 2 or 3 kids someday, and I'm now in my 30s, and to just explore that. And that's something that we at Kindbody are really passionate about, is just making sure that men and women truly understand their fertility as it relates to time. But the short answer is that unless you have a specific personal medical complication or history, there is no problem with being on birth control pills for 10 years or more.
And Dr. Peña, kind of someone's asked, they would like to know kind of the process that your body goes through when you do transition from maybe hormonal contraception to a non-hormonal form, and kind of how long it takes for your body to kind of adapt, and also kind of just what it goes through.
Because we get that question a lot on our platform, and it really depends on what type of method they were on, right? Because there's different types of hormonal contraception. So whether it was an IUD or whether it was the pill or what kind of pill. So, I would hate to make a blanket statement, but what I would say is traditionally you can transition, but you just have to take the considerations, right? Be safe. Traditionally we'll also offer or recommend making sure that you do a second method of contraception, as well, if you're transitioning. To make sure that you don't have an unintended pregnancy or an unwanted pregnancy. But I would say, make sure that you discuss with your provider exactly what method you're taking, what method you're planning to take, if it's non-hormonal, and what plan you have, if it's natural cycles or a different plan to, monitor your fertility cycles, and then make a personalized plan that would work for you and will really make sure that you're, reduce your risk of pregnancy if that's what you're intending to do.
And kind of sort of lastly, just before everyone goes, for people who are looking for resources and kind of looking for more information and maybe want to change but don't know where to go, I'll start with Elina. Kind of what would be your initial recommendation if people are curious about natural cycles or making the change? What would you say?
Well, I think a very good resource for information is our website. You can read and also take a quiz if natural cycles is for you or not. And you can read up on our research and studies. And we also have a great blog where we talk about women's health and reproductive health in general, if you're curious about not just natural cycles, but about other things as well. It's called Cycle Matters, and you can also find it from our website.
Amazing. Dr. Sasan?
Again, same. I would certainly advise people to visit our website. I think it's such a personalized, individualized thing. I highly recommend viewers to schedule virtual appointments or in-person appointments. You can make all of those appointments from the ease of kindbody.com, and regardless of where you are in the world or country, and having that personalized one-on-one consultation with a physician that can go over your individualized plans and give you that information on a one-on-one basis, I think is so valuable. And so that would be my recommendation.
And that's Peña.
Yeah, just always make sure that the information that you're seeking online or through platforms is coming from reputable sources. And if you have any questions, reach out to your medical providers. Those are your best sources of truth. And again, in terms of, I like to tell my providers and my patients, medicine is an art. We consider it an art, and really our patients are works of art. And that's why it's so important that, you talk to your providers, make sure that all of you is being taken into consideration before you make a decision as to what's right for you. Just make sure that you get good information and pass the good word along and continue to educate others as well.
For sure, absolutely. Well, thank you so much, everybody. I've got the results through of the poll, so I'll read those out. Of the people who said how many times they changed their contraception, 37% said they changed once, 27% said they changed twice, 14% said they changed 3 times, and 22% said more than 3. So I think it shows an openness, doesn't it? It's a really positive thing, and it's always positive to be curious. Well, thank you so much for everyone attending, and thank you so much to our experts. You've been great. It's been really, really great.
Thank you so much.
Thank you.
Thank you.
Bye.